Dr. Wong. So
Hi.
today we'll be asking some of the questions regarding stroke.
Sure.
First is, what is a stroke?
Okay, first of all, stroke is very common. So stroke is basically damage to the brain due to blood vessels problem inside the brain. Okay, so there are two main types of stroke. The most common type of stroke is due to blockage of blood vessels inside the brain causing damage to the brain. That makes up to about 70% of all stroke. The rest of 30% is caused by rupture of blood vessels inside the brain causing damage. Okay, so literally means that stroke is damage to the brain due to a blood vessel problem.
Okay.
Yeah.
Then what are the causes of stroke?
The causes of strokes, there are a few very common causes of stroke. Number one cause of stroke is hypertension, high blood pressure. The rest of the common causes of stroke include diabetes, high cholesterol, irregular heart rhythm, and cigarette smoking. So these are the common causes of stroke. Yeah.
So when they get a stroke, what is the common signs of the stroke?
Okay, stroke. If you were to use a very simple way to detect stroke, you can remember the word FAST, F-A-S-T. Okay, so F-A-S-T stands for something. F stands for face. So face, if you have a crooked face, the face droop down, then that could be a sign of stroke. A stands for arm. So if you put out your arm straight out, and if one of the arm drop down, then it could be a stroke. Okay. S stands for speech. So if somebody suddenly have talking difficulty, then they may be having a stroke. Okay. And T stands for time. So if you see any of these signs, if you suspect it's a stroke, please bring the patient to the hospital as soon as possible, preferably with a specialized stroke center. Yeah.
So what should they do when the stroke occurs?
When you suspect somebody is having a stroke, bring them to hospital with a specialized stroke treatment center as soon as you can. Because there are two things that we can do. There are a few things we can do. Let's say most of the stroke are due to blockage of blood vessels. So let's just focus more on that. So if you bring the patient early, especially within the first 2-3 hours, the earlier the better. There are a couple of things that we can do. Number one, we can give a very powerful injection to try and unblock the blockage. That has to be given within the first 3-4 hours. The earlier the better. Don't wait until 3-4 hours, but just bring as soon as you can. Then the second thing that we can do is we can use a device to unblock the blood vessels. Let's say if the blood vessels, the blockage of the blood vessels involves a large blood vessel, the injection may not be able to unblock the blockage. So we need to use a device like a stent device, like the one they use to do the balloon treatment for the heart. But now you can use it, and we can push the device from the blood vessels in the leg all the way to the brain, and by using that device we can remove the blood clot and unblock the blood clot. It's called endovascular thrombectomy. So these are the two things that we can do if you come early. And if you do it early, unblock the blood vessels early, that will minimize the damage to the brain, and therefore the future. So these are the two things that we can do if you come early. And if you do it early, unblock the blood vessels early, that will minimize the damage to the brain, and therefore the future recovery will be much better.
How will we recover from stroke?
Okay, so how do we recover from stroke? Number one, bring the patient to a specialist who specializes in stroke as soon as possible, so that we can do one or the other or both that I just mentioned, either to give a powerful medication to unblock the blood vessels, or use a stent device to unblock the blood vessels. So that's the first step. Okay, after that, by using medication and all that, we will be able to stabilize the patient. And as soon as the patient becomes stable, we should start rehabilitation, which is a very important part of stroke recovery. Okay, what is rehabilitation? Rehabilitation is basically literally trying to retrain the brain. Okay, so how do we do that? there are a few very important things: physiotherapy, occupational therapy, speech therapy. These are the three main rehab therapies that we can do. Okay, and the earlier we start, the better, and that would help the patient to recover to the maximal possible recovery.
Is there a time frame for the recovery?
Yeah, of course. As I mentioned earlier, the earlier the better. So we better start rehabilitation as soon as the patient is stable, and usually the time frame is, for recovery is between 3 to 6 months. So if you don't do any rehabilitation within that 3 to 6 months, beyond that, the recovery will be very minimal. Yeah.
So for the last question, so how do we prevent recurrence of the stroke?
As I mentioned earlier, we know the common causes of stroke. So if we can identify those causes, for example, hypertension, diabetes, high cholesterol, smoking, and irregular heartbeat, and if we can identify those causes, then we should treat those causes and optimize those problems, and that would help to prevent future stroke.
Okay, so that's all from us. Then thank you for Dr. Wong for sharing.
Okay, thank you.